You're watching a special presentation of WENY News and New York Local Ithaca.
Hello, everyone. I'm Renata Stiehl with WENY TV and New York Local Ithaca. And this is a special presentation for our community in Ithaca and Tompkins County. We're having a discussion regarding the COVID-19 coronavirus pandemic that is affecting everyone, no matter where you live, all across the globe. This is truly a global problem that we're all working through together. And we wanted to come together as a community, bring in some different voices and talk about what's being done as we work through this, from the health level to the local governments to our school districts. So we've brought in some guests to take part in this discussion. We're joined by Frank Kruppa, who's the Public Health Director for Tompkins County. We're joined by Leslyn McBean-Clairborne, who's the Chairwoman of the Tompkins County Legislature. Superintendent Dr. Luvelle Brown with the Ithaca City School District, and Mayor Svante Myrick, Mayor of the City of Ithaca. So thank all of you for taking the time to talk with us.
Thank you.
So my first question is for Mr. Kruppa. We want to start off by talking about what COVID-19 coronavirus is. It's a new virus where it's all we've been talking about, I feel like, for about 6 weeks now, but we're still learning a lot about it. But can you talk about what COVID-19 is, what type of virus it is, and how it affects people?
Sure. First, thanks for having us on here this afternoon. Coronavirus is, they are not uncommon. We've had coronaviruses in our kind of disease system on a normal basis, but this is a new strain. And I think, as most everyone is aware of by now, since we've been following it for about 6 weeks, is the main symptoms are shortness of breath, fever, and a dry cough. There are others, less frequent symptoms that folks experience, but those are the main ones. We don't have any immunity in our systems because it is a novel strain, so we don't have a vaccine. Everyone is experiencing this for the first time, so they don't have antibodies yet built up. And so that's why we pay such particular concern to these novel diseases, because we don't have that immunity within our community to help us protect ourselves and limit the spread.
Okay, and I want to talk about how it seems to affect some people worse than others. Some people, their symptoms are very mild. Other people are very severe. Unfortunately, we have had a large number of people pass away here in New York State. Can you just talk about the different levels of severity and who might be at greater risk of experiencing some of those more severe symptoms?
Sure. There's a wide range of symptoms that folks are experiencing, or severity of symptoms. Some people might not even know that they had COVID-19. Their symptoms might be that mild, all the way to folks that are able to stay at home but have significant symptoms similar to they might experience with the flu. And then you have those individuals that need to be hospitalized and unfortunately have passed away. So there is a wide range. We know that it is more difficult for our senior adults to handle, and so obviously they're our most vulnerable populations, but also folks with underlying health conditions that might affect their ability to fight the COVID-19 in their system. So we're still encouraging everyone to stay home because we need to protect those most vulnerable amongst us.
And now I want to talk a little bit about the what people can do to protect themselves. Svante, I know that you have been very upfront in your messaging about what people can do, wearing masks when you go out in public, practicing that social distancing to the best of your ability. And I feel as though you've been trying to demonstrate that yourself to the residents of the city of Ithaca. So can you just talk about your goal with getting that messaging out and why it's been such why it's been so important for you to be visible to the Ithaca community during this time?
Yeah, sure. Thank you, Renata. And thank you for describing my efforts as insistent and not as annoying and harassing, which is what I have been doing as I'm shouting out my window go inside and put a mask on. And yeah, trying to every day on social media, in traditional media, and even in person, trying to send a message, first by wearing a mask myself in public, second by actually physically closing down places where people congregate, right? I mean, obviously, so many of our businesses have made a sacrifice and closed, and so many people are losing their jobs and employments, and people are losing their lives. And it seems the least we can do, the least we can ask, is a similar sacrifice of recreation. So, you know, we took down all the basketball hoops, something that, frankly, if 15-year-old me had heard that I'd done, I would lose my vote forever. That would be it. I'd never again vote for Svante. And that's okay. We had to close down the playgrounds. We had to close down the skate parks. Things that we are proud to provide for the people of Ithaca, but right now we're asking people to sacrifice it. Why is it? It's so that we can buy time, so that Frank and his team at the health department and the Kugel Medical Center and our entire healthcare system can help the people who most need it, and we can keep as many people as healthy as possible. So flattening the curve has meant, for me and for us in the city of Ithaca, doing everything we can to send a message that you've got to stay home if you can, wear masks whenever you're in public or in contact with anybody else, and to do this as an act of love.
All right, thank you for that. And Leslyn McBean-Clairborne, you're the chairwoman of the Tompkins County Legislature. The county government works very closely with the county health department. There's been a lot of communicating going on with the different county departments, but also with the school district and the city of Ithaca. Can you talk about some of the coordination going on at that level so that everybody's on the same page in regards to an approach as we handle this?
So thank you, and thanks for hosting us on this. I am actually going to give all credit to our county administrator, Frank Kruppa, and other members of our emergency operations team that came together very quickly to make that level of coordination happen. Of course, with legislature support, making sure that they have what they need to continue to reach out to, you know, whether it's press conferences or reassigning staff duties, staying on top of what are the executive orders that we can support the county administrator implementing, making sure the departments are following what are the guidelines that have been put out there so that they too can help support the incident command team working in making all of these collaborations happen and happen smoothly. I think Tompkins County has been doing very, very well. Yes, I'm a little biased, I'll say, in my opinion, better than many of our communities who are still preparing for this. Our response has been swift, and you know, it's because we do have a government that works very closely with our administration, with our staff to make it happen.
Okay, and my next question is also for you, because of the measures that we've had to take in as a state and as a nation. We've had to shut down businesses. We have a lot of people who are, you know, quote unquote, non-essential, that have been laid off temporarily, hopefully temporarily. We have people that are being furloughed. We have people whose jobs have now been eliminated. We have parents of young children who their children are now at home and trying to manage schooling. And Dr. Brown, I'll get to you about that in just a minute. But overall, we're seeing people that are probably having to reach out to have access to different services and resources, maybe on an expanded scale, or maybe they've never needed them before, but now they're in a position where they need to have access to food. They need the access to transportation. We've got a vulnerable community and are homeless. So what is being done, or how are our most vulnerable residents finding access to those resources that they so desperately need at this time?
Well, there's several measures that we're taking. One is we have a very robust 211 call-in system. They can answer just about any question and point people to resources. Our EOC also pulled together just about every human services agency within our community to be a part of making sure that people will get the services they need. So those who are responsible for transportation to get together and talk about how we provide transportation for folks who might need it to still get to work or who might need it to get it to testing sites. So pull the transportation folks together and they talked and came up with solutions. Pull our people who have been doing food insecurity, managing food insecurity issues for years. So Food Bank of the Southern Tier. With the mayor's support, we were able to connect with Cornell University and their food pantry, Food Bank of the Southern Tier, to open up a new, more accessible downtown food pantry for folks who can't drive to others, but who can walk to get there. So a lot of, 211 answering questions. Also, a lot of our legislators reaching out to the communities they represent, to their constituents via social media, listservs that we're all on, letting people know where to find resources and sending the message that even if you have never used resources before, this is not the time to be shy. This is not the time to feel like, oh, I'm taken away from someone else. We all are in need right now. So we've been trying to push that positive message to please reach out. We would rather you reach out than you suffer in silence. So call us. We'll walk through with guidance from the state or Department of Social Services has relaxed some of the requirements for people to come in and sign up to get support and services that they need. So all of those things have been happening, collectively. And then just some of our local businesses also chipping in. We have a business just down the street from where I work. They had put out a call and people came through and bought lots of gift cards that can be distributed to people who we know who are in need. They're not only a deli, in Shortstop Deli, but they also have some, household items that people might want to pick up as well. So some of our businesses have been doing, that sort of stuff, and we get the message out, again, through our listserv, social media, everywhere that we can. And our legislators, I will give them a lot of credit, have been doing a great job in talking with their municipal leaders and their constituents, making sure they get that information and sending the message to please come get help. Don't be shy.
Mm-hmm. Thank you for that. And now, Dr. Brown, I wanted to talk to you about the school component of this. Mm-hmm. We have had to close down our schools because, to help flatten the curve and help mitigate the spread of this virus, you had to make this tough decision to close down schools in your district, and all schools now, our students are not going to school. They're still doing their schooling from home. But that presents a lot of challenges for so many families. So Dr. Brown, can you talk about that decision to transition to remote learning and how that's going for the Ithaca City School District?
Sure, thanks for the question. Thanks to the great leaders on this call with me. It was Friday the 13th, about a month ago, when Frank and Leslyn and I stood there, and we were probably the first county and the first school district in our state to make that tough decision to close. And I warned then that this would highlight the inequities that existed in our community, the lack of broadband access everywhere, the lack of food security, housing security. It has been tough. And in this community, this very academic community, there were folks who wanted us on February 15th, that Monday after that Friday closure, to continue our educational program as if we were just to flip a switch. They wanted to have instruction continue with no preparation, send me the work, and let's keep it moving. We took our time. For us, it's been much more important to be right now than do. We care and we love, and we needed to check on our families, and it's taken us some time to make sure our young people are fed. We're delivering thousands of meals to their doorsteps to get them instructional materials. We're delivering materials, learning materials to their doorsteps. To call, we're checking on every family, and we're asking questions like, how are you doing? How can we support you? Not, when can we grade you? or when are you going to log into Google Classroom? It's a very different conversation. And across our country, we're seeing right now the school districts that are focused more on content than they are on connections. We're focusing on connections and relationships. And at the same time, we've trusted these amazing educators we have to build out an instructional program to continue our learning. And that has taken some time. It's been amazing in our community how folks, Cornell at the college, they had 3 or 4 weeks to prepare to continue their distance learning. The professors had 3 or 4 weeks, the students had 3 or 4 weeks. And there's Ivy League institution and some of the best students in the world. Folks wanted our teachers in Ithaca City School District and our students to start immediately. So it was just interesting. And I have been helping our community to temper some of those expectations and to be patient while we're thoughtful about how we take what we've been building for 10 years, a great project-based approach to learning, focusing on thinking, true engagement, how we transition that into a blended, a virtual environment with hopes that when we come back, it'll be a much more blended environment in the near future.
Okay, and can you talk about some of the assistance you've been able to provide to accommodate students who maybe don't have reliable internet access or maybe internet access at home at all? And how are they still able to engage with their teachers and their classmates to continue their schooling while they're at home with limited resources?
And part of that connection, we had to ascertain who those families were, and we've narrowed it down to a couple of dozen. Now we've gone out to those individual homes. Initially, we were providing hotspots on buses at our schools, and folks were asking if they could come to that spot and access the internet, and that was okay, but we needed to do more because transportation is a barrier as well. So we're now in homes setting up internet access with our community partners. Spectrum has been great. Our technology department has been great. So we're providing that access in homes, and we're doing everything we can to make sure young people can have access, quite frankly, that those families have never had before.
Great, thank you.
Mm-hmm.
And my next question is for Leslyn and then Svante, because it kind of covers both components of things. While so many of us are still transitioned to working from home, and a lot of our legislators and city councilors are working from home, government is still working. You still have meetings that you have to hold. There is a level of access to the community for those sort of things too. So Leslyn, I'll start with you. So how has the legislature transitioned to online for holding meetings, and how the community can still engage with what's going on with our local government?
Well, for all of us, Zoom is our best friend these days. That is what we're all doing. That's the platform we're using. Yes, you're right. We have to continue to meet because, business has to go on. We have, at the legislature, what we have done is created a new email system to allow the public to send comments to us. Because of course they can't attend the meetings for public speak necessarily, because we haven't figured out yet how to allow for the public to attend via Zoom, but then when we need to go into executive session or something, how to not have the public there. So we are allowing for information to come to us electronically from the public ahead of time. We read those into the record. If people send us email comments, we did create a public comment for legislatures, so it's coming to us, so that we can do exactly that. Of course, according to the guidance and the regulations, the executive order of the governor, we do have to make sure that our meetings are still recorded, that they can be played at a different time. At the same time that we are meeting, it's being live streamed still, so that people can pay attention. They can see, they can listen in, they just can't comment. So we continue to make those accommodations as best we can. Like I said, we are all on the Zoom platform.
All right, Svante?
Yeah, same. Yeah, Leslyn said it well. So not only are we continuing to meet online and making those meetings available to the public, we really are shunting off a lot of decisions, anything that might be controversial or is not time sensitive. We don't want to hold these votes while people aren't able to physically attend the meeting. So there are a lot of decisions that we are putting off to the future. And this is revealing quite a lot of inequities, right? It really does reveal who has access to broadband and who doesn't, but it also shows us that different people are showing up to these virtual meetings than we're showing up in person. Turns out showing up in person is a level of privilege in itself. Are you free Wednesdays at 6 o'clock, right? If you're working, right, do you work the night shift? Are you taking care of kids? Do you not feel physically comfortable enough, or do you have a disability that prevents you from attending these meetings in person? Well, those meetings have been dominated in our community, and I know communities across the country, for decades by the people who are free, available, and comfortable enough to attend meetings in person. So it's making us all think a little harder about how our government functions. And I'll just put in a plug, Renata, for the folks you see on this call. I mean, what Frank and Tompkins County are doing is remarkable. The fact that we, as diverse and wide-ranging a community as we are, the way they've been able to flatten the curve, the way that Luvelle has been able to lead our school district, not just in these past couple months, but over, it's been about a decade now, to incredible heights, not just to the highest levels of academic achievement, but the lowest levels of disparity and inequality. And the way Leslyn leads the legislature, all of these things are at risk because local governments are not being right now supported by the federal government in the same way that private businesses and individuals are. And you might think, well, if the federal government is sending money to individuals, won't that eventually help government? Not really, because what Frank and Tompkins County does, what the school district does, what Leslyn and Tompkins County, what they do, are funded in large part by sales tax revenue. And so even if you deposit a bunch of money in people's bank accounts, the fact that they are not buying and selling from each other means that there are no transactions to tax, which means that we are all going to be facing fairly large budget gaps going into the future. And unless the federal budget I mean, that's why I told my workforce last week, I'm taking a voluntary 10% salary reduction, because we're going to have to be looking at belt tightening all the way around unless the federal government comes through in a big way and help support local governments so they can keep delivering for the kids of the school district, for our health departments, for our police officers, firefighters, and frontline workers.
Yeah, I think we can all agree that there's going to be some significant long-term repercussions out of all of this. And Svante, you touched on the federal government, but I want to drop down to the state level briefly and talk to Frank again in regards to the New York State PAWS Act. Svante, you'd mentioned that we need to do our part to flatten the curve. I think people are taking that seriously and doing what they can. But Frank, my question to you is, the governor has issued an order of no essential travel. Don't leave your home unless you absolutely have to. So what kind of things are considered essential travel? You know, we can't always have groceries delivered. We need to have access to certain appointments or access to the grocery store. So what, can you elaborate on what would be considered essential in regards to travel or leaving your home?
Yeah, we definitely want everyone to stay home. And we know that that can be challenging. And when we say we want you to stay home, really going out for groceries, going out for medical appointments or to your pharmacy or for essential work are really the only reasons we want people leaving from home right now. And I know that's challenging to achieve for a lot of people, and we've tried to put a lot of supports in place to help them be successful with that. But that really is what we're talking about. And I know early on, we were encouraging people to support local businesses, go to drive-throughs, those kind of things, and I can certainly appreciate that. And we love our local businesses and want them to survive through all this as well. But now is the time for everyone to stay home. So unless they're going out for groceries, going out for medical needs such as the pharmacy, or are called in as an essential worker, it's really important that we all stay home.
Okay, and now on Wednesday, April 15th, Governor Cuomo updated his executive order in regards to facial masks. Just a couple of days ago, he said if you are an essential worker and you're interacting with the community, social distancing guidelines can't necessarily be followed, that you need to be wearing a facial covering. He's now taken that a step further, recommending that everyone wear facial covering if they cannot maintain social distancing. So Mr. Kruppa, can you talk about, what people can do? Because not everyone has access to, what we're so commonly, I've never heard the term PPE before until the past couple of weeks, and now everything's about PPE. So if you don't have access to that, how can you get some, or what other steps can you take to make sure that you have that covering to help, and how does that help protect you?
Those are really good questions, Renata. And the governor has kind of had an incremental approach to this after the CDC's guidance changed to encourage individuals to wear a cloth mask where they couldn't maintain the 6-foot social distancing separation. There is an important distinction here. Generally, when we're talking about PPE or personal protective equipment, it's things like N95 masks, face shields, gloves, gowns that are reserved for the medical professionals. And we still want to make sure we're clear that those materials we definitely still want to save for our healthcare workers. What we're talking about for the general public and other essential workers that are not healthcare are cloth masks. And there are many different versions that you mentioned. The mayor had demonstrated his that can be purchased, but they're becoming harder to find through that mechanism. So they're very simple to make. There's a lot of different videos. The CDC, the New York State Department of Health, the Tompkins County website, Health Department website has video examples of how you can do that. It's as simple as using a couple of rubber bands, folding up an old piece of cloth. It could be an old t-shirt or other type of cloth you have around that's large enough to cover your nose and mouth, and then can just loop over your ears to hold it there. And the purpose for that, and this is also important, is that those types of masks are not designed to protect the wearer. They are designed to protect everyone else from the wearer. They are there to capture the virus, if you have it, from being spread to other folks. So my mask protects you, and your mask protects me in those instances. And that's an important distinction we want folks to know about.
Okay, and I want to talk about, we're spending a lot of time discussing protecting our physical health, but I want to talk about our mental health as well. There's so much anxiety surrounding all of this, and whether you're concerned about the potential impact on your health. Maybe you've lost your job. You're dealing with your children at home and how you're managing, making sure that their education continues. There are some serious mental health aspects of this that I think we need to talk about. So Frank, I'm going to start with you again. I may jump around to a couple of other of you to chime in on this. What are some mental health resources that are available to people during this time? So Frank, I'll start with you.
That's a great question, Renata. And I also serve as the county's mental health commissioner. And so this is a really important issue for me. We've been very fortunate that both our county mental health department and our local mental health partners have been able to stand their services up and stand them up very quickly as we've evolved. So most all of them are now providing mental health services through telehealth. And they are active and available as the resource. Their information is on our webpage, but 211 also has access to all of that. And so I would encourage anyone that feels like they want to talk to someone for whatever reason it might be. 211 is a good place to start to get connected to those resources. And going back to something Leslyn said earlier about folks that might need financial support, the same thing goes here. You may never have needed mental health supports before, but now's not the time to suffer in silence. If you need help or you just want to talk to somebody, reach out. We have folks ready and able and willing to support our community as we go through these very difficult times.
Dr. Brown, I'm going to point the same question to you, but frame it for maybe a parent or a caregiver of a child in the district. The kids, depending on their age, they might not quite understand what's going on, but they know, like, they're scared maybe because they don't understand, or you've got so many seniors that are now looking at major changes to their final weeks and months of the school year, and how that can just affect their mindset as they finish out the school year, and whether they're headed off to college or whatever their path may take them. This is, you know, whether you're in kindergarten like my son is, or if you have a child who's going to be a graduating senior this year and experiencing some of these mental health components. Is there a place, does the school district have a resource or a place that they can direct parents to as they work through this?
Sure, and the mayor shutting down the basketball courts didn't help, by the way. But yes, I mean, this has been traumatic for our school community across the board. That's why our powerful educators are needed now more than ever. The resource that we can provide and that we have been offering has been our educators, our social workers, our counselors, our teachers, our classroom teachers, to reach out. We've had young people reach out to us, and we're reaching out to them. So we don't want our families isolated. We're helping families navigate. You know, now for the first time ever, our families have access behind the curtain to all that we do in teaching and learning in a school district. They're now having to do what we do, everything from organizing a school day. I know Leslyn's probably struggling with that right now. Where do you start? When do you take a lunch? When do you take a break? How long do you study? When is independent work? We've had to help families understand how to do that. Very essential skill right now. So we are offering up those supports. We're about to kick off a webinar series where we're going to be providing some supports for families, have them call in and ask us specific questions. So yeah, again, a month in, it's highlighted these issues, but now more than ever, the relationships and the connections are so vital and so critically important.
So the next thing I want to talk about is we're hearing a lot about looking ahead to reopening. When do we reopen? How do we reopen? That's a really, there is no blanket answer for this, I know. So Leslyn, I'll start with you looking at it from the county government perspective. What kind of conversations, I guess, need to happen? So when you closed everything down, it was a coordinated effort. It's going to have to be a coordinated effort to open things back up. So can you weigh in on that, just kind of looking down the road, whether that's weeks, months down the line?
Oh, I wish I had that crystal ball. We hope it's not too long because like Svante said, you know, our economy is suffering. People, you know, aren't shopping. There's no money to do it. You have to decide between paying the rent or going to buy groceries or any number of things. So we have to look at that. We have, you know, through our committees, and I know Svante has been involved with our chamber and other folks who are part of the Economic Development Committee, our Tompkins County Area Development Agency, just people getting together who have the understanding of what's needed and what would be needed and beginning to plan for that recovery. I mean, we're still in probably our second phase of response as it is right now. Yes, our curve is, you know, sort of plateaued, but we still know that at any time things can change with this virus. So having folks begin to look at what would recovery look like and how do we roll that out, that's some of the things that's happening. So our chair of our Housing and Economic Development Committee being involved, our executive director of the Chamber of Commerce being involved, like I said, our Tompkins County Area Development director being involved as well, with a group of people who can begin to think about that, who don't have to think about response, but can begin to put some plans in place for what it's going to look like. It is going to take, I have to echo what Svante said, it is going to take some serious support from our federal government for this to happen. The stimulus has come for various things, and we're hoping that that would happen for municipalities as well and come directly to us. Not go to the state, but come directly to our local municipalities so that we can put it where it really is needed. To jumpstart our economy, we're going to need that. So we have a number of people who are really planning and thinking and talking through what is it going to look like.
And Svante, can I have you weigh on that as well?
Sure. Yeah, as Leslyn referenced, we've created an economic recovery cabinet, right? Leaders from around the county, in the private sector and the public sector, from the banking industry to small mom and pop stores to our governments to the colleges and universities. Right now, we are all planning the response. We are figuring out what can we do to minimize the economic fallout? How can we partner together to make sure that we rebound even stronger than we were before the virus? One of the newest products just came out this week, which is we partnered with Tompkins County as well as a bunch of other folks to create a fund that small businesses can access for a small loan. We call it a loan, but in truth is it's forgivable and there's zero interest on it. So as long as it's intended to be a bridge, right, to help businesses who need help stay together. That's the kind of idea that's coming out of this recovery cabinet. But I'll tell you what, I will never complain about my school taxes ever again. Not that I ever, Dr. Brown, not that I ever complained before, but it's very clear. Here's what's very clear. Nothing can reopen until the schools reopen, or I should say very little, right? We can't go back to normal without the schools. Why? Turns out schooling is a bedrock of not just our society, but also our economy. That people can't go back to work full time, businesses can't operate as normal unless they know that their children are in a safe place being educated by professionals. So the big question, when can we reopen, really centers around the schools, and I think should inspire all of us to appreciate just a little bit more the work our teachers do, our administrators do, and our superintendents do.
Well, I do want our superintendent to hurry up. Schools, because it's a struggle. In addition, very quickly to what Svante said, we also have workers who provide childcare services. Who, for them, this is a difficulty as well. Frank was talking. You asked Frank, Renata, about just the mental health stuff. I have caregivers. One of the departments of the city that I supervise is GIAC, we're community center. We do after school programming. And I have caregivers who are working from home, are supposed to be working from home is what is required of their employers, but they're going crazy. They're like, I can't do it because my children wouldn't let me do it and they don't know how to manage that. So yes, Luvelle, we need our schools open. So just hurry up and wave a magic wand or something.
I'm hoping Svante texts Governor Cuomo to help me out with that a little bit.
We'll work it out.
We're all in it together.
That brings me to the question to Dr. Brown. What does reopening the schools look like? How does that happen?
Well, one, it looks like ensuring our young people's safety and our employees' safety. So everything, and Frank can speak to this much better than I, everything from having appropriate testing in place, having some sense of what social distancing will look like in a large setting like that. We're not unlike Cornell University and Ithaca College. I think when we say schools, it's going to be schools in general, higher ed and K-12, and what it would look like to provide a safe environment for that to happen. Now, I'm also hoping that this is not just a crisis and we use this opportunity to truly innovate, because when school reopens, again, I've already alluded to, our parents are going to have access now that they've never had before. We're going to need to engage parents in different ways in the near future. I'm hoping that when schools reopen, K-12 is truly a blended environment. Up until now, that has not been the case. We have not embraced the digital and blended environment as we should have, and now we're being forced to do so. And I'm hoping when school reopens, and Svante, please help me with this, there are policy implications associated with it. For the history of our school district, funding and competency has always been connected to seat time. We're in a situation right now where that is not happening. It does not require a young person to sit in a classroom in a brick and mortar building to be determined whether or not they have an understanding or competent with that material, and for us to get funding. So hopefully there are some policy implications and some policy shifts that will occur, some family engagement shifts that will occur, and a new normal as far as our instructional delivery, in addition to ensuring their safety. So I'm looking at this as an opportunity. If not doing those innovations, it's simply just another crisis.
Okay, so I want to try to wrap this up, but end things on a very positive and uplifting note. So I'm going to go one by one. I want to ask each of you to report on any positive developments or things that have inspired you or reassured you as a community leader. So does someone want to raise their hand if they have a moment that I know some of you might need to think about it for a second. All right, Svante raised his hand. So Svante, we'll start with you, and then we'll go to Leslyn, Dr. Brown, and then end with Frank. All right, Svante, let's hear it.
Well, I just wanted to jump. There's no shortage. I mean, it's happening every day. I usually, it's very funny. I would leave my office and I'd see all over the city of Ithaca, I'd see happy people, and I'd wonder where were they all day, because none of them were in my office. None of those weren't the meetings I was taking, because usually the phone calls I get, it's for every one phone call of somebody offering to help, there were 10 folks with a complaint or concern. It has been inverted completely. For every one phone call I get with somebody complaining, there are 10 phone calls with people offering to help. Their ideas, they're sewing masks, they've got a potential solution, they want to donate, they want to volunteer. And that spirit is just infectious, and it's everywhere. And our first responders, I should tell you that we had an officer who just, and this happens a lot, but we had an officer who was called to a scene because a woman got out of a taxi and she didn't have enough money to pay the fare. She thought her boyfriend was going to pay it. The boyfriend wasn't home. It's the middle of the night. She's crying. The cab's like, I need my money. The officer said, well, what's the difference? And he said it was a $17 difference. This police officer reached into his own pocket, pulled out $20, gave it to the taxi driver and said, let's go on. People giving more than anybody could rightly ask for. I've seen it all over this community in the last month, and it gives me great hope.
All right, thank you. Leslyn?
Svante, I am right with you. It's just been positive to see all the things that our community have been doing. Svante said, from mask making, people are coming forward, because we know not everybody can go out and buy a mask. Not everybody has the skill sets to even read the directions and how to make one, et cetera, et cetera. And so people have been just like, I have a sewing machine, I have some fabric, who has some elastic, I can make this happen. And they've been doing that, and we're able to sort of share with each other. That has been fantastic to just see that Tompkins County has been responding to the message about social distancing, that we continue to look good and score well in terms of, yes, we're practicing this right. And for me, from a political end, I actually feel very positive about the leadership that we've been seeing from our governor in organizing, other governors within our area to sort of coordinate what an opening is going to look like. That's not a novel idea, but it's leadership, and just sort of seeing that in action. Even when we're all sort of, what is going to be the next executive order that's going to send us all into a tizzy, even when we're there, we really do appreciate that. In our community, our young people, yes, they have been very hurt with the removal of the basketball hoops and everything else, but listening to some of them say, if you didn't take that out, we probably would have been out there just doing what we normally do. And getting that understanding and sharing that message with each other has been extremely, extremely positive. Luvelle, I have to say, the whole technology learning and understanding that people don't have to sit in a classroom. I've never been a classroom person. Tell me when the exam is, I'll show up for it, but don't make me sit in the classroom. I don't know why I'm sitting in meetings these days, but it's difficult. But to allow that opportunity, I know my daughter absolutely loves that. She doesn't like sitting in a classroom. So to see all those things that are happening and people embracing it, those opportunities has been great. And the last thing I'll say is recognizing that of this point, we haven't been to a place where people are beating each other up in the street. When folks got to a place when they were being disrespectful and discriminatory in their actions against Asian folks, that this community started to speak out. Svante did, I did, community members did, and agencies have opened up their doors to say, we are a safe space. We will not make this happen in our community, not because of a virus. This is not the time for us to be doing this. There's never a time for us to be doing it. So all those things just give me such hope and happiness on an otherwise gloomy situation.
All right, and with that, Luvelle, I'll go to you.
Thank you, Svante and Leslyn. You just inspired me. I would just add that there's so many unsung heroes out there right now. I know for a decade, I've heard about how buses are late here, how sometimes our buildings aren't clean enough, teachers aren't grading appropriately. You know, I'm not hearing that anymore. We have bus drivers and food service workers on the front lines delivering meals to individual homes for families who need that meal. We have bus drivers taking out Chromebooks and Wi-Fi devices. We have teachers who are managing their families, spending hours and hours on Zoom calls like this, planning, connecting in Google Hangouts, calling families. They're working more hours now than ever before. So in public education, you know, we've gotten a bad rap the last decade or two. I think now folks are understanding the work and the dedication and the love that exists in organizations in K-12, and particularly in this community, as our folks are going at it. And in many ways, they're saving a community.
All right, thank you for that, Dr. Brown. And Frank, we'll end it with you.
So my inspiration comes from my team, both at the county and at the health department. It has been amazing to see what they've been able to do under some very difficult circumstances. I know for a lot of us, as Dr. Brown referenced early, March 13th, when the decision was made to close schools, that's kind of when it became real for our community. Our nurses and other staff at the health department have been dealing with this since the end of January. We've been following travelers from around the world. We've been investigating people that have symptoms, that had travel history. So this has been going on for them for a long time, and they've never flinched. At every moment that we've asked for their help to address this situation, they've stepped up, whether it's working long hours, talking to anxious and angry folks that are calling on the phone, to just really helping sick people navigate what can be a very scary situation. They have been nothing short of amazing. And we would not be in the situation we are, having disease levels the way that they are today in Tompkins County, without the work of those nurses and other public health staff. And they're often nameless people. A lot of folks watching this probably didn't know what the health department did prior to the middle of March, but these folks do this every day, and they've dedicated their lives to making our communities healthier and safer. And I just thank them for their efforts, and that's what keeps me going. And wear your mask when you're in public and not 6 feet away from someone. Thank you, Svante.
On a video call.
Yes, and so Svante is so graciously demonstrating using that facial mask appropriately. Again, the governor recommending as of Wednesday that everyone use those facial coverings when going outside. I want to wrap it up by saying thank you to all of you for your time today, your candid comments, answering these questions, and really keeping the community informed. I started off by saying that we're all in this together. We truly are. We're all going to get through this. Things may look a little bit different on the other side of things, but we will get through this. We are in this together. So thank you so much for your time today and sharing your message here with the community.
Thank you.
Thank you.
Thank you, Renata.
Thank you.
For all of us with WENY TV, New York Local, and Lilly Broadcasting, we're going to say goodnight.
This has been a special presentation of WENY News and New York Local Ithaca.